They were having to use the money that she was earning to stay in the hotel room, which means they couldn't save money to get into a home. So they were stuck in this vicious cycle. My name is Jodi Rodgers, and I'm a community health worker with the Community Medical Clinic in Access, Kershaw. I met the Smiths back in November when they came into the clinic needing help finding a doctor. They had moved to South Carolina about a year ago and really didn't know where the resources were in the area. Didn't have much support and trying to find out where to go for help. This first meeting we had, they explained that they had both gotten COVID a few months ago and were out of work. And because of this, they got evicted from their home. When I met them, Miss Smith had been able to go back to work and Mr. Smith was trying to find a job. They had been sleeping in their car since they had lost their home, and when it was too cold, they would try to get a hotel room. With Miss Smith only working and them needing to get a home, they were having to use the money that she was earning to stay in the hotel room, which means they couldn't save money to get into a home, so they were stuck in this vicious cycle. So I gave them Brittany Harris's number at SE Stay and asked them to call her to see if there was some way that she might be able to help them get into a home. Maybe they could pay the deposit, the first month's rent, that type of thing. So about a week ago, I was going through my caseload and decided to call them to check to see how things were going. And Mr. Smith answered the phone. And when I asked him how everything was going, he said everything was wonderful. That about a month ago, they had moved into a home, that SC Stay had helped them pay some deposits and also even reimbursed them for the hotel rooms that they had to get. So they were able to use the reimbursement money to buy some furniture from the Habitat store, and the Habitat store even delivered the furniture to their home for free. They had gone to their Sandhills medical appointment and were trying to get their health back on track. They were both working and doing jobs that they love, and during our conversation, Mr. Smith even mentioned that they had started going to church, and they were very involved in the church now. So I asked him, I said, Mr. Smith, when did you start going to church? He said, about a month ago. I said, isn't it funny how things work out? So I told Mr. Smith how excited I was for them and how happy that everything had fallen into place and that they were doing so well. And he just explained to me how thankful they were that they had found me, that I was able to help them connect into these resources to help them get a home. Because they didn't know anybody here. So they were just so thankful that we were able to help them. So this was just one example that I wanted to share, that when all these agencies, when we all get together and we work together as one, how many lives can be changed.